How do cervical cancer types impact treatment options? Imagine your cervix as a tiny gateway between your uterus and vagina, and cancer can develop in different ways depending on the cells involved. The two main types of cervical cancer are squamous cell carcinoma and adenocarcinoma. These types are classified based on the kind of cells where the cancer begins, and they influence how doctors decide on the best treatment. Squamous cell carcinoma is the most common type and starts in the flat, thin cells lining the outer part of the cervix. Because of its prevalence, treatment options for this type are well established. Usually surgery such as cone biopsy, where part of the cervix is removed, or a hysterectomy, which removes the entire uterus, are common choices for early-stage cancers. Sometimes, if fertility preservation is desired, a procedure called trachelectomy might be considered. For more advanced cases, especially if the cancer has spread beyond the cervix but remains within the pelvis, chemoradiation is the standard approach. This combines chemotherapy drugs like cisplatin with radiation therapy to target the cancer effectively. Adenocarcinoma begins in the glandular cells that produce mucus and other fluids in the cervix. It is less common but can be more challenging to treat because it sometimes responds differently to radiation. For early-stage adenocarcinoma, surgery options similar to squamous cell carcinoma are used, but the specific approach may vary based on tumor size and location. When the cancer is more advanced, chemoradiation remains the main treatment, but doctors might adjust the radiation techniques or chemotherapy drugs based on how the tumor behaves. When cervical cancer reaches an advanced or recurrent stage, treatment shifts towards systemic therapies. Chemotherapy can help control the disease, and targeted therapies or immunotherapy may be options if the tumor expresses certain markers like PD-L1. These treatments aim to attack the cancer at a molecular level and are used regardless of the histological type, but their effectiveness can depend on the specific cancer biology. Every patient's situation is unique, so treatment plans are personalized. Factors like the cancer stage, the patient's overall health, and whether they want to preserve fertility all play a role. A team of specialists including gynecologic oncologists, radiation oncologists, and medical oncologists work together to develop the best plan for each individual. In summary, while both main types of cervical cancer, squamous cell carcinoma and adenocarcinoma, share many treatment options like surgery, radiation, and chemotherapy, their biological differences can influence how well they respond to these treatments. The stage of the cancer and personal health factors are equally important in shaping the best approach. Always consult with a healthcare professional to understand your specific diagnosis and treatment options, as they can provide guidance tailored just for you.